When I was in med school we were shown a patient who had both lungs fully collapsed, yet he came into the hospital all by himself and was only complaining about it being slightly difficult to breathe. In med school got to scrub in on a case that bypassed the emergency room and went straight to the OR. Older woman had pointed a shotgun right in the middle of her chest, and aimed it down and to the left. The entry hole was a perfect, neat, little coin-sized opening. On the other side of her was absolute shredded carnage where most of her left rib cage was shattered, left lung gone, and you could still see her heart somehow still beating. She was overall stable under anesthesia and oxygen, but holy shit. The surgeons worked for hours and got her put back together as best as they could with whatever she had remaining, and one of them said she's going to hurt like a motherfucker, and she's still going to wish she was dead. I am a medical resident on my ICU rotation. Last year, we were looking after a patient who had undergone seemingly uneventful open heart surgery. Over the next several days, he developed an infection, which is not uncommon. People get pneumonia after anesthesia, the skin around the surgical site can become infected, etc. Weirdly though, he seemed to be getting worse despite aggressive antibiotic treatment. Somewhere around the 5th day, it is time to take the drainage tube out of his chest. They are placed there after every surgery like this so that blood does not accumulate around the heart, and lo and behold, literal feces start pouring out of this poor man's chest cavity. Turns out the cardiothoracic surgeon had punctured the man's intestine with the tube on the way up to his heart, essentially creating a highway for his colonic microorganisms. Ended up with multiple bacteria and fungi running rampant in his chest, abdomen, and bloodstream. Obviously needed repeat surgery to get everything cleaned out, somehow survived, in the short term at least, despite being pretty sick to begin with. I'll never forget looking at that CT scan though, horrifying stuff at the late to the party, but why not dash? I am a doctor. A couple of months ago a young guy comes in for a CT of his chest, abdomen, and pelvis. His history is difficulty swallowing and not very hungry. I read the studies and I have never seen so much cancer in any one patient in my entire career. Over half the volume of his chest was filled with metastatic disease, his liver was entirely replaced with cancer. His spleen was a single large met and one of his kidneys was completely destroyed. He has diffuse carcinomatosis throughout his abdomen with massive ascites and every lymph node was abnormal and enlarged. A CT of his neck showed huge lymph nodes and a MR of his brain revealed at least 8 separate metastases. Apparently, when he was 16, about 9 years prior, his mom took him to the doctor where they removed a skin lesion that turned out to be melanoma. He was referred for follow-up, but mom decided they were too busy. Skip ahead to today, the guy is still around and his tumors are shrinking, a bit. He's doing okay, mostly comfortable, and hanging in there. Mom is a basket case. I had a cousin that survived 2 weeks with a ruptured appendix, and the doctors at the time said if they hadn't seen it beforehand they would have said your chances of surviving that were pretty much zero. He was in hospital quite some time after the surgery, but he ended up being just fine. Had a little pain in my knee. Thought it was a pulled muscle, kinda felt like it needed to pop. Tried to get it to pop by kicking my foot out twice. Didn't pop, so I figured I'd go sit down and massage it. Took a step and got dizzy with a little tunnel vision and hearing impairment. Went to the hospital and walked in. Mentioned I thought it was a blood clot, previous job as EMT, so they took me back. I laughed and joked the whole way, poked fun at a nurse for blowing a vein in my left arm. Did a chest CT and they found a fairly large saddle pulmonary embolism. Doctor mentioned that I shouldn't have been awake with the percentage of blockage I had, let alone walking in and being my jovial self. Got me meds and gave me a nice suite for a weekend. I'm now on blood thinners for life and damn are they expensive. Not a doctor but. When I was 4, doctors discovered I have been living with celiac disease and diabetes mellitus, so type 1, not type 2, since I was born. At that time I was a lot shorter than everyone else my age because I couldn't grow. They tested my blood sugar and it turned out I had a blood sugar of 67.8 millimoles. which is 7 times more than what is normal and 3 times what you need to faint, and about 13.0 millimoles over what you need to be pronounced in critical condition. I could have died at any moment. Doctors said I was a 1 in a million. I'm 17 now and everything is going great. Not a doctor, but a patient. I was in a bad car accident in high school where I went off a 38 feet drop. I was conscious and got out of the wreck. The ambulance picked me up and noticed my blood pressure wasn't reading correctly and had trouble finding a pulse, but they didn't seem too worried as I was talking and awake. We get to the ER and again they're struggling to find a stable pulse. They continue to try to figure it out while they start stitching up the wound on my head and I just passed out. Turns out, I was probably bleeding in the car a lot longer than I realized and had lost over 30% of my blood volume. The paramedics didn't realize how much I had bled because the car landed in a way that almost none of it ended up on me. The car was on standing completely vertical on its front, and I didn't seem confused or show other signs of hypovolemic shock. The hospital gave me a plasma transfusion and fortunately everything turned out okay, but the doctor told me it was a lot closer to turning out bad than I realized. Later that week, we went to get my stuff out of the car and the entire hood and most of the dashboard were just covered in blood. My mom just broke down in tears and couldn't go near the car. It was crazy. 35 plus years ago, my dad, age 53, a farmer, never any health insurance, developed pain in his gut. Always had a touchy stomach, nerves, stress, food. It was bad enough this time, or different enough, that he finally went to the doctor. Little country clinic says, and sends him to the nearby hospital to get a scan/X-ray. It was a day or two after that long to read scans back then. They called him and said, "Get to the hospital now. Your appendix has burst." Just he and I at home. I was 13, so he drove himself to the hospital. He recovered, but it was a tough surgery and it was probably hours from being too late. The surgeon said the appendix had partially burst, then had tried to heal itself. Fast forward 30 years. My sister, age 53, develops stomach pains. She suffers with it for a night and finally tells my mom maybe she should go to the hospital. Her appendix had burst. It was hours from being too late. I've got less than 3 years before my appendix expires, it seems. I was on rounds in the outpatient clinic with our internal medicine doctor. A patient walks in and complains of blurred vision. Routinely one of us, the students, would get up and check the blood pressure manually for practice. It was my turn. Mind you, this is the first time I practice on real person, that's not one of my friends. I confidently wrap her arm and place my stethoscope and start pumping. I hear the first throb on the reading too fast. I pause, and start again. Again, the first throb comes too fast and I check the reading again. I slowly lock eyes with our doctor. She finishes explaining something to our round group and makes eye contact with me. "So, what's her BP?" I pull down my stethoscope and slowly pass it to her. Not sure, but I think you should check it out yourself." Her face went pale. It was 240/120. 0.84 BAC. As someone I know led the doctors to say they had never actually seen one that high. Sent her home 8 hours later, still shit-faced. My mom went 2 years without managing her type 1 diabetes. She finally went in for a checkup. I knew I had a heart murmur my whole life. Started getting chest pains and other symptoms around my 30th birthday. When I finally got around to seeing a cardiologist, they performed surgery exactly 18 days later. 3 centimeters by 4 centimeters hole in my atrial septum, wall between the upper chambers. My cardiovascular surgeon literally said it's like someone blew a cannonball through it. He waited until after surgery to say that. Not a doctor, but I heard a story about a guy who got shot in the forehead with a nail gun, scared the living shit out of the guy who shot him with it, calmly climbed down the ladder he was on to take care of the guy who shot him. The guy had fainted and fallen off of the building they were working on. Drove this guy to the hospital to get his friend checked out. Anyway, he pulls up to the hospital with everyone staring at him, and saying things like, "Oh, are you okay?" He took his friend to a doctor and the doctor stared blankly at him and grabbed a mirror, showed the guy his forehead with a 1.5-inch nail stuck in it, and the guy immediately passed out. The doctors treated him and he was fine, but damn, that's crazy. Not a doctor, but I had a case of undiagnosed type 1 diabetes. Had a blood sugar of 867 mg/dl at 12 years old. Keep in mind, 600 mg/dl is enough to kill an adult male. My dad was diagnosed with stage 4 lung cancer when he was 17. Wasn't a smoker, despite it being the 50s. Sure, he smoked the odd cigar, but he could probably count the times he done that on one hand. Doctors confirmed with a biopsy, which involved splitting his chest open horizontally. He has a scar basically from nipple to nipple. Well, right above the nipples. They give him the horrible news: you have 6 months to live. So he comes back in 8 months later feeling just fine, but kinda wondering what the actual fuck. They take another look and, holy shit, it went dormant. You can Google cancer dormancy, it's not super well understood. But basically, for whatever reason, the cancer just says, "I'm good here. No need to expand. I'm fine with how things are." It's still in him. It could kick back into high gear any day now. But he's 72 and he's survived decades of boozing, logging, heart surgery and a stroke, so if his old friend cancer killed him, he'd probably just LOL and say, "I had a good run." Not a doctor, but worked in the X-ray department back then. So they brought someone up from ER, still on the stretcher, and they being the paramedics. Both is quite unusual. The guy they brought was a junkie, high on whatever, and had tried to embrace a truck. Maybe he should have chosen a parking truck, but he had not been that smart. He had broken about every bone one can break without dying on the spot. On his X-ray request form nearly everything was ticked. And he still hadn't recognized that he had a problem. Or at least not the vital details. The paramedics, one X-ray person, and me, non-medical bureaucrat, were put in lead shirts and assigned to hold him down. He actually kicked and punched at the people